climate crisis is already a health crisis, and no one is immune. Climate change is the greatest health challenge of our time. Rising temperatures, floods, droughts, and shifting disease patterns threaten lives everywhere, especially in vulnerable communities. The crisis goes beyond the environment. It impacts mental health, chronic conditions, and the very systems we rely on. But we can act together. By building resilient health systems, ensuring equity, and curbing emissions, we can protect both people and planet. The climate crisis is a health crisis, and addressing it means saving lives. Join the dialogue now. World Health Summit, the leading platform for global health.
Good afternoon, everybody. My name is Joy, and I want to welcome our distinguished guests and partners, most importantly, the Honorable Minister and learned colleagues who are here this afternoon. So we have a crisis. Our planet is in crisis. Health is in crisis. So we need to harness the opportunities that are available to us. The World Health Organization recognizes climate change as a fundamental threat to human health. Climate change is already adversely affecting public health, as you all know. In Europe here, heat waves have already contributed to a loss of over 70,000 lives. On the African continent, where I come from, rising temperatures and flooding are expanding mosquito ranges, prolonging transmission seasons, increasing breeding sites, accelerating parasite developments, and our children, who are already suffering from pneumonia because of the use of firewood, are now being more and more exposed to malaria. And it is estimated that within a decade, 700 million more of these children will be exposed to malaria. So this session will explore opportunities to drive transformative change across all sectors and will emphasize the agency of fast, fair, full, funded fossil fuel phase out to protect and to promote the health of these children and our communities. The need for strong leadership, global and community level, national levels to translate evidence and commitments into effective health-centered climate policies and action. So we have an erudite selection of speakers this afternoon, but to launch us on our expedition for the afternoon, it is my honor and privilege to welcome our keynote speaker, the Federal Minister, Federal Ministry for the Environment, Climate Action, Nature Conservation, and Nuclear Safety, a hefty portfolio, Minister, Minister Carsten Schneider.
Yeah, Joy, hello. It's nuclear, right? But you're safe here. Excellencies, ladies and gentlemen, very, very warm welcome here in Berlin and the Interconti. We, the German government, are very pleased to have you here. You are holding this important conference. We are living in a time of great change, with exciting technology, but also with immense global challenges and growing tensions. This is also clearly noticeable in the health sector, as we have seen. Constructive dialogue across national borders and disciplines is therefore needed now more than ever. That is why I'm very pleased, as an environment minister, to be here today with you, the health experts. This session is dedicated to climate. Thanks for that. The effects of climate change are tangible. Droughts, heat waves, and floods are becoming more frequent here in Europe and worldwide. This is having serious impacts on people's health, our economies, nature, water supply, and on social stability. It's our responsibility as governments to protect people, nature, and infrastructure. We can only achieve this through consistent climate action and precautionary measures to adapt to impacts of climate change. The German government has set the goal of becoming climate neutral by 2045, decided in spring this year. It was the start of this new government. This goal is now enshrined in our basic law. To this end, measures are being taken in all sectors, expanding wind and solar energy, electric mobility, and restoring intact nature, so that, for instance, forests and peatlands can be turned back into carbon sinks. We are also committed to a strong EU climate target. We support international initiatives that advance climate action worldwide. At the same time, Germany is taking a systematic approach to climate change adaptation. We have created even a legal framework for precautionary action at federal, state, and municipal level. We have an adaptation strategy with measurable targets and indicators. This legal framework is 2 years old. We are promoting the exchange of knowledge and experience, and we have also set up funding programs to assist municipalities and social institutions in adapting to the impacts of climate change. That is why different policy areas must be interlinked. Environmental and climate policy, food and health policy. The One Health approach is the right way forward. The Environment Ministry works closely together with the World Health Organization, in particular through the WHO collaborating centers. For example, the Collaborating Center for Air Quality Management and Air Pollution Control is based at the German Environment Agency. It focuses on the impacts of indoor and outdoor air pollution and climate change on people's health in Europe. It regularly updates recommendations like the WHO Heat Action Plan guidance. Here, my ministry was able to provide input from the German adaptation strategy that I mentioned before. Through the German Environment Agency, we are contributing to science-based policy advice and capacity building. Robust environmental protection and climate action are essential for a livable future. They also offer the chance to make many aspects of life better for everyone. Let me elaborate on this with some examples. If we burn less fossil fuel, it will save CO2 and make the air cleaner. Less particulate matter and nitrogen oxide will mean better quality of life and health. Protecting and restoring forests, wetlands, and soils. Right. Helps bind CO2. This helps stabilize the water balance, secures habitats for animals and plants, and creates recreational areas for humans. Important aspect. Adapting to climate change means more green and water areas, particularly in cities. This cools and improves air quality. In addition, parks make cities more beautiful, as you can see not far away from here in the Tiergarten. Spaces are created where people like to spend time. These examples show how great the role health plays in climate action, environmental protection, and climate adaptation. It makes perfect sense for us to consider how these issues interact with one another. Events like the World Health Summit are vital in this regard. I'm also here today because it is important that the international community stands together in the fight against health risks. Climate change and pollution affect all of us worldwide. We can only find solutions together. The World Health Organization is an institution that it is as competent as it is indispensable. And underline this, as indispensable in these efforts. Those hit hardest by climate change and environmental degradation are often the ones least able to protect themselves. Children, the elderly, sick people, and people on low incomes. We owe solutions to these people. We have the technology, the science, and the resources to fight climate change and create a more sustainable future. This is something I will work hard to achieve, and I hope together with you. Thank you very much.
Thank you so much, Honorable Minister. It's been an honor. And Germany is building a livable future for us. But the question is, are we all building this livable future? And we have a panel here which is going to speak about exactly that, whether we are actually all building a livable future for our planet. And I would like to ask the members of the panel to come up to the podium. I will start, of course, with Professor Andy Hines, who is going to be our first speaker. But Professor, you have the floor. And I will also ask the other members of the panel to join Professor Hines. We have Vincent Breton. I will introduce you when it is your time to speak. And we have Ethel Marcel. We have Victor Zhao. We have Elizabeth Kimani. And we are really fortunate today to have this global leader in climate change and health, Professor Andy Hines, whom you all know very well from the London School of Hygiene and Tropical Medicine. Professor Hines, you have the floor.
Well, thank you so much for the kind introduction. It's a particular pleasure, Joy, to be on the panel with you, because Joy has been the co-chair of our Pathfinder Commission together with Helen Clark and myself, and I'll briefly mention some of the work that we've been doing. Before I get into the opportunities that we are confronted with at the moment, I just want to remind you of where we are in climate change terms. And this is a very recent slide showing the most recent projection of where we're heading. So as you can see, for virtually the whole of humanity's history, up until very recently, we've lived in a fairly stable climate, the Holocene. And it was the Holocene period during which humanity really changed from being hunter-gatherers to agriculturalists and then latterly industrial populations. And in the last few decades, it's become apparent that we're in a totally different geophysical epoch, which is generally called the Anthropocene, in recognition of the fact that it's our species that is really changing the whole global environment. And you can see how the accumulation of greenhouse gases, carbon dioxide, methane, and others has now increased the temperature 1.2 degrees if you take the average, but last year was over 1.5 degrees, and we're heading probably towards 3.1, over 3 degrees, depending on the action that we take in the next few decades. And that increase in temperature will pose profound challenges for human health, some of which are summarized on this slide, and I won't go into detail, But the point I want to make is that human health is impacted on by multiple pathways. The obvious direct ones, extreme heat and so on, exacerbations of air quality, poor quality because of wildfires, effects on pregnancy and childbirth and the health of the youth, of children, the effects on water quality and quantity, food supply and safety, the distribution of vector-borne diseases, we've already heard about that, dengue, malaria and others. And of course, it has an impact on the social determinants of health, increasing poverty because you can't work outside when it's very hot, also probably influencing conflict, as we've already heard elsewhere in this meeting. So many, a very wide range of effects. And the important thing to say is that we can now distinguish between natural variability and climate change caused by human activities. And we can now attribute health effects to human-induced climate change, and there's an increasing number of papers that do that. So the signal is unequivocal. So what can we do about it? Well, we've already heard we have to both mitigate and adapt. And often these two activities are seen as very separate activities. People working on adaptation, for example, working on climate-resilient agriculture or emergency preparedness, flood protection, disease surveillance, and so on. And those people on mitigation work on clean renewable energy, efficient public transport, active travel, energy-efficient homes and buildings, and healthy, sustainable diets, although probably not enough attention to the latter. But increasingly, we need to integrate these two, because if you don't integrate them, you get maladaptation. You can get distorted priorities. You can put air conditioning everywhere, but if you do that, you increase demands for electricity. You have to put the heat somewhere, so you put it out and increase the urban heat island. You can increase air pollution, and you can disadvantage the poor. And of course, the healthcare system is an important player in this. It's about 5% of greenhouse gas emissions. A lot of that comes from supply chains. So the healthcare sector has a direct role in mitigating and adapting to climate change, and also an indirect role by working with other sectors like energy, disaster preparedness, urban development, agriculture, and so on. So what are the opportunities? The scale of the opportunities are really enormous. These are the often called the health co-benefits of climate action. So they're benefits that occur in the near term, in addition to the longer term benefits of reducing the risks of dangerous climate change. These benefits are felt in the near term, in a few years, perhaps even more, perhaps even shorter in the case of air pollution. Our recent estimates suggested over 5 million deaths annually caused by air pollution from fossil fuel burning. Of course, that's not the only cause, as we've already heard, but it's a very, very important cause and a dominant one. Over 5 million deaths, one estimate suggests, due to physical inactivity, and the best way of getting people active is through the transport system, using public transport and active travel. And we've just heard in the last couple of days that the Eat Lancet Commission has prepared a new report, and its new estimates suggest even more premature deaths could be, 15 million deaths annually, could be prevented by shifting to healthier diets over coming decades. And that would result in a reduction in greenhouse gas emissions, particularly methane, from reduced consumption of red meat, for example, but also a big reduction in biodiversity loss, because the food and agriculture system is the major driver of biodiversity loss. Of course, we have to embed inequalities in all these policies, because we know the top 1% of emitters are responsible for about 17% of global emissions, something of that order, and the top 10% are responsible for virtually half of the global emissions. So they have to take the lead, and they have to reduce their emissions more quickly to make room for the bottom 50% who are responsible for very little of the global emissions. So in the Lancet Pathfinder Commission, we synthesized the evidence for the benefits of moving towards a net zero economy. And we showed that there were indeed big benefits, and I've summarized those in the previous slide. But it's important to recognize that much of that work is modeling. So it's mathematical modeling, which is very, very important. It tells us the potential magnitude of the benefits. It doesn't tell us what happens when we actually try to implement those policies. What are the problems? What are the barriers? What are the trade-offs? And what are the actual magnitude of the benefits? And so we're now working very much to accelerate the implementation of climate action for health, particularly focusing on evaluating the impact of implemented actions. And in our work, we also collected a number of case studies where various governments, sometimes national, sometimes subnational, sometimes local groups, had implemented change and estimated the reductions in greenhouse gas emissions and the benefits to health. This is just one example from the Renewable Energy Portfolio Standards in the US. Sadly, these are being undermined at present, but they did produce big benefits to the climate, about 150 megatons of CO2, and several thousand premature deaths reduced over that 8-year period. So win-wins. We also came across this interesting example from Victoria in Australia. This was an interesting randomized trial where they randomized half the households to have energy upgrades in the pre-winter and half after winter. And they showed that those that had more insulation, they moved towards away from gas to electricity. They had a reduction of about 6,000 tons of CO2 equivalent during the winter, much more if you count the whole year. But importantly, this led to warmer homes, reduced feelings of breathlessness, better feelings of subjective mental health, and importantly, reduced healthcare costs. In fact, the healthcare costs outweighed the cost of the retrofitting of the homes, which is a very interesting observation. So win-win-win. And then finally, this is an active travel example from Buenos Aires, the Más Bicis Menos Emisiones, a bike-sharing scheme. And what they did was to really scale up the use of bicycles, and they separated the bicycles from the traffic, and therefore they had a reduction in numbers of cyclists killed, but also documented a big savings in CO2 emissions. Obviously, cycling is not possible in every city, it's not safe, but you can increase public transport, make public transport affordable, and that's an important opportunity also to take a little bit of exercise walking to the train station or the bus stop. So we are collecting a whole range of these different examples. If you want to know more, you can read our Commission report here. We've also created a Climate and Health Evidence Bank, which summarizes much of this information. You can just download anything that interests you. And we have a regular newsletter if you're interested in signing up. And we have many partners. So let me just conclude by saying it's absolutely true that climate change is a very major and growing threat to human health. It's a threat, I'm afraid, of our own making. It's humanity that's causing these emissions. We can now confidently attribute health impacts to climate change, but the other side of that coin is that there is a big opportunity to improve health, both in the longer term by reducing the risks of climate change, but also in the near term by moving towards a healthy net zero economy. Thank you very much.
Thank you so much, Professor Heinz. So you have shared with us the evidence on the health benefits of climate action and also ways that we can integrate this into health and equity. I will come back to you with some questions, but I would like to go to Dr. Elizabeth Kimani, who is working in a research institute in Kenya and is able to share with us national climate strategies that they are applying and how they are working. Thank you, Doctor.
Thank you. So I'll be talking about equitable community and multi-sectoral engagement for health core benefits. So I think it has been said many times about the climate and health burden, and Africa is highly impacted by climate change, and the health of people is highly impacted. And Kenya faces serious climate hazards and health risks. The heat, the rising temperatures, the floods and the droughts. And especially, we have a part of Africa, a huge part of Africa is arid or semi-arid, and really droughts are becoming a major problem. And there is a strain in health systems because of these hazards, deepening inequalities, and slow climate resilience. So we have been working in this space, and part of the work that we've done under the Pathfinder initiative is really evaluating or analyzing the policies, the policy framework in Kenya for health core benefits. And we have a strong climate change kind of policy framework in Kenya. And we were able to analyze national and subnational level policies. And we were analyzing them for policy content, actors, processes, and context to see really how the health co-benefits are being included and how there is that multi-sectoral, multi-stakeholder engagement. And what we found is that there are still gaps. I mean, there is effort, but the integration of health co-benefits is it's still a big gap. And really, this is important because when you talk about Africa, for example, we need to think about health co-benefits of mitigation and also adaptation actions, because really there is a lot of impact on health from climate change in Africa. And there are no indicators for health in these policies. That is a gap. And there are missed opportunities for really bringing this or integrating these health co-benefits. For example, when we have mitigation actions like transition to clean energy, not including the health benefits of reduced air pollution and other kind of mitigation and adaptation actions. And there is the issue of equity gap, the issue of especially community engagement in the policy formulation and policy implementation is a big gap. So there is great need for integration, for multi-sectoral and multi-stakeholder engagement, including community engagement, because the climate change crisis is complex and no single sector can deliver a net zero transition or health co-benefits alone. And so we also need efficient use of resources by reducing duplication. So really working in silos is duplicating efforts. And we need to build community resilience through inclusion of communities in this formulation of these policies and implementation. And especially we need to engage vulnerable communities, those living in arid and semi-arid areas who are heavily impacted, and also the urban poor who, in sub-Saharan Africa, for example, the number of people living in urban poor settings is increasing. And these climate actions should be shaped by the voices and perspectives of communities and to promote social equity, inclusion, and justice. So the entry points for action include climate finance mechanisms, really being able to include climate health co-benefits when you think about the finance, the budgets and the finance mechanisms, leveraging existing coordination platforms, and capacity building. Capacity building is very important. The concept of health co-benefits is, and also the interlinkages between climate change and health is still not fully understood by policy actors, by communities. So we still need to build a lot of capacity and really also building capacity on how this can be included. We need evidence generation and knowledge sharing platforms. We also need to establish and strengthen technical working groups to bridge climate health and to be able to include these core benefits. And we need community participation, creating spaces like youth, women groups, and groups for vulnerable populations to be able to be included. And integration of health co-benefits in ongoing processes, for example, policy reviews, amendments, and implementation. So in conclusion, I want to highlight two quotes, one from a community member and one from a healthcare practitioner. From the community member, to ensure community actors are fully involved and motivated, there is need to ensure transparency and accountability in the formulation of health and climate policies, as this will be essential in building of public trust, improving policy effectiveness and equitable outcomes. And then from a healthcare practitioner, with the donor funding cuts, there is need to prioritize preventive over curative services. The monies budgeted can be invested in community units as an epicenter of healthcare to empower communities to cope with the climate change-related health issues. These voices just show how important it is to include communities and policy actors and policy makers in policy actors like civil society and other groups in this policy making. So building a resilient net zero environment or future needs collaboration, equity, and shared ownership across all levels. And there is need to mainstream health and climate policies, strengthen participation, and share evidence. Local communities should be empowered to co-create solutions and that integrate knowledge, local knowledge, and also break silos and really engage communities. Thank you.
Thank you so much, Dr. Elizabeth. Am I audible? Thank you very much. You have really demonstrated to us what your findings have been in the research, but also the gaps that you have in the communities. And so it's a systemic challenge. And I think one of our global leaders best placed to address the systemic challenge and how we actually transform our systems is Dr. Victor Zhao. He is the president of the National Academy of Sciences in the US, and he's going to share with us some of the transformative, approaches that they have come up with. And over to you, Dr. Zhao.
Thank you. Thank you, Joy. Joy is one of my favorite chairs and moderators because I work with her on GPMB. You moderate a lot of meetings, and thank you very much. And Andy, good friend Andy Haynes, and Atel, and of course all the others. Dr. Elizabeth was a very nice presentation. So what I want to talk about is who we are and why we do this. As you heard, our National Academy was founded in 1863 by Abraham Lincoln as an independent scientific body of scholars and experts to address important issues for the nation. Our work, of course, expanded much more than US, but globally in many of the collaborations. But importantly, as we look at what we do, we realize, of course, that we are much more than an academy. We have 2,000 members elected. We have 90 Nobel laureates. We have many policymakers, leaders like Andy Haynes and others. But we want to convene everybody to solve big problems globally and nationally. And this is one of them. About 5 years ago, we started the idea of that we should look at climate change and health. And I convened a large group of planners to say, what is the issue that we can make a difference? And what came out is this idea of a grand challenge. A bold idea, bring together public, private sectors together to address one of the biggest issues, as you heard, of equity, climate, and crisis. This grand challenge is chaired by Judy Rodin, who's a former president of Rockefeller, a member of our academy, and has participation of Sir Andy Haynes and many others. We have now over 300 collaborators across this grand challenge. And in fact, it's public-private partnership. So we include then the last Biden administration, the Assistant Secretary of Health, the Office of Climate Change and Equity. We have private sectors, biopharma, medical device supply chain, because we have university students, healthcare providers. All together, we say, this is what we should do as a major issue. So when we step back, we say, what do we want to do? We decide there are 5 different areas. First, let the public know that this is a crisis, communication. Educate our workforce, our students, and healthcare providers that this is, in fact, something they need to learn about climate resilience. Second, as you heard from Dr. Haynes, that 5% of global carbon emission is from the health sector. So we need to ourselves decarbonize and work towards net zero. And of course, do no harm, as you say. Third, of course, research innovation is so important. There are many research questions. So what we just recently published is an assessment of the gaps in research and what the opportunities are. From low-income countries, high-income countries, to AI technology, you name it. And of course, as you all heard from Dr. Elizabeth, equity, community, and you're going to hear a lot more from Secretary Attal later on about how important this is. So we have a program that works in the community, and particularly in high-risk marginalized community, to find co-product solutions. And then finally we say, you have to have changed the way we do things. The last bullet is a roadmap system transformation. I should say that in the second bullet, in decarbonization, we now have a whole movement in the United States. And we have 700 hospitals and more sign up, all moving towards trying to reduce carbon emission footprint. So I want to give you the message. Many of us in the US believe in climate change. We're still working and going strong. Now, the issue here is how do you mobilize, as we have now doing, as many people as possible to work together collectively. So one important area we recognize, and this is with the help of Andy Haynes, Judy Roden, they co-chair the commission I talk about, is look at systems. Because when you think about yourself, health sector, I already described the health sector. But there are many other sectors like energy, agriculture, heavy industry, transportation, urban construction, all are emitting enormous amount of carbon. And there's tremendous potential if you were to do mitigation, but at the same time look at the health impact. So the co-benefits are enormous, and that's not been fully explored. So we believe that health is a unifying force and catalyst for change across all landscape. Health is the center of climate change actions. Now, in this regard, there's not too much work done in how to do this because every sector look at consumption, emission, and economic impact. Rarely do these sectors measure what are we doing to health. And you can imagine what can be a lot of issues can be happening in health in this area, right? In terms of extreme heat, pollution, but also agriculture and others can be solutions, in fact, to climate change. So we want to unify all these sectors together and find a way to call systems transformation. Now, when you look at system transformation, including all these sectors, you have to think about governance, policies, economic structures, and societal norms. That's the journey that we have embarked on. So in this big initiative, the fifth one I talked about, transforming systems for climate change and health, as Andy would tell you, it's actually a net zero well-being economy. Well-being economy. So we want to transform systems altogether, high and low-income countries, learning from each other, finding the best buys to reduce emission and build climate resilience. At the same time, we want to make sure that all the actions we're taking are improving population health, equity, and well-being, and that we support inclusive economic resilience and fiscal sustainability. So what we did a couple of years ago, we launched a commission on reimagining systems for a healthier climate future. As I said, it's co-chaired by Judy Roden and Andy Haynes. we have 23 members who are multi-sectoral leaders, global leaders. All WHO regions represent its true international work. And throughout 2025, this past year, we're working towards how to create the report and the recommendation of what to do. So what we started working on is to gather information through workshops and then develop a straw framework and then ultimately put all the evidence together to write a really important report to be brought to the world leaders for implementation. So we have 3 workshops we're holding, and we already held 2. The question is identifying promising strategies and actionable interventions to address the most pressing climate-related threats to health. First workshop is what? What of system transformation? How do you anchor climate action and health in all? Second is how system transformation. What are the strategies, levers for health-centered climate action? Third is how do you transform in context? In which case, we're looking at country-driven pathways for health-positive climate action. And this will be held in December, in fact, in Africa CDC, and Nigeria, Ethiopia, pardon me, co-convened by UN Foundation, us, and Africa CDC. So let's take 1 minute, say, well, what have we learned in the first 2 workshops? First, you have to transform systems. Be bold and not little incremental fixes. You have to value equity, care, and rights. Second, as been said, implementation is a big issue. It's a big challenge. So you have to rethink about incentive and indicators, how it will help people to make decisions and to implement, not only looking at the economic piece, but metrics and also governance and finance. Third, of course, you have to align the structural levers of change. I mentioned governance, finance, culture, law to create a condition for transformation. Fourth, you have to measure. As I said yesterday at the signature meeting, you can't improve what you don't measure. So we have to measure so they can move systems forward, particularly capturing the co-benefits. And then culture, as has been said, is so important. Culture and narrative are critical. So important to tell the story to policymakers, so important that young people tell the story, and so important to everybody think this way as culture. Of course, you have to have long and short-term financial, economic returns that can be measured. And finally, you want to really align across all the scales, embedding health and climate in all systems. My last slide. So we now are launching, therefore starting January, a committee to develop this roadmap. So from system transformation to a roadmap how to do this. As you see, it's called Achieve Health for All at Net Zero Emissions. Building on the straw framework we learned today and the workshop learnings, we're going to continue moving forward the case-based evidence studies, look at contextual factors, sectors, and then at the end, looking at how to go forward to scale. And of course, most importantly, actionable recommendations. And of course, our job will be to go forward, not only with the completion of this work, but to release a report. And then, Andy, you and I have a lot of work to do to make sure that the policymakers globally hear this and work together with all of you to make changes. Thank you.
Thank you very much, Professor Zhao. Thank you very much. So we now have a guide on the systemic change that is required. And we have a proposal on the table for the roadmap. We have learned what the gaps are and what actually still needs to be done. And fortunately for us, we have with us today the special envoy for COP30. And as you know, COP30 in Brazil will need to have climate and health at its center. So we are looking forward, Ethel, to you championing this and looking forward to advising us on how to get this on the table and at the center of the agenda. Thank you.
Thank you very much, Joy. I was aware that I'm the only one that has no slides. So what I bring to you, it's hope. I think we have like 3 days, a lot of discussion, sometime with pessimists, other time with more optimists. So as a special envoy for COP30, for the health sector, my role is more like a diplomacy talk for all, with all sector, try to put everything in the same table and try to build this conversation around this climate crisis and the health crisis that we are together. So we work along of this year with the Belém Action Plan, and that we will be launched in the COP30. And it's a very complicated word right now. I don't need to explain. I think Victor was very good to say that still in every country we have science, we have ethics, and these things are very alive in United States and in all over the country. But it's very complicated to do a diplomatic agreement in this complex environment. But we are trying in COP30 to build this Belém Action Plan. That is, we have like this very complicated word right now, climate justice and equity, words that we are having agreed for a long period of time, but right now we disagree with this word, unfortunately. But it is the base of this plan, and this was building in 3 actions: surveillance, as Victor and Dr. Heine was showing, and Elizabeth too. And the first action is enhance surveillance to have more integrated data, because we have climate data, we have health data, but in the most part of the country, they are not integrated. So it's very complicated to explain this for policymakers, how this is important, because with that we don't have good data for this in country level and in municipality level. And the second action for this plan, it's capacity building, training, health system with resilience, and the third one that I think Vincent will be touching much more is innovation and technology, and that health sector can be very good. It's an important play in this innovation and technology for this net zero. And but why we are doing this? So I think the most important, it's why we are coming with this plan. Because until now, in COP28, that you have the first health day, and COP29, that we made a declaration that the health day will be go on for all the COPs. But we are very good to have a declaration, a roadmap, a paper. We are very good at this. Right now, we have 10 years of Paris agreement, but very few was put in place. So I think this is the moment that the Global South and Brazil, since in the G20 presidency, put climate in the center of the conversation and try to build this reshaping the conversation, because we always have the Global North saying that the Global South should do when, where, and if you do this, we will donor, we will pay for this, and this is the more way that we shape our world. But right now, what we want to say is that we don't want to this negotiation anymore. We need to reshape this. We need to put people that is in community, indigenous population, traditional people in the center of this conversation, because they are the one that keep the forest. They are the one that keep our water clean in the most part of the planet. And this is why just in this week in Brasilia, there is a pre-COP negotiation, and there is a lot of countries that come together to put a new trust, a new fund, but trust with investment, monetize this for tropical forest fund forever. To have this country that has forest, that is responsible for our clean air and all this relationship that we have with nature is still very, very conservative. It's difficult when we are thinking another language, but I'm sure that we can understand each other. And they are responsible for this conservation in the planet, but they don't receive nothing for this. So this is a trust that was building to pay for this conservation. So this will be launched in the COP30, and we think there will be a very good way to start this conversation to protect this land, to keep them still with the forest in a good place for all of us. And for this Belém Action Plan, and I'm going to finish with this, it's important to know that we are doing this for people that living in a favela in Rio de Janeiro, the population, indigenous population in Amazon region, in a lot of this country that has this forest, for the Indonesia, for the Malaysia, for Africa people, for the South that is united to say we have a voice. We need to be put our conversation in equity, transparency, governance, but we want to lead also this conversation. So we need to put what we need, what we want together. We don't want anymore that you give money and say how we can expand in this. So this is the way that the COP30 was building. This is the way that the conversation are going. And I hope we can come out in next November with an agreement of this and reshape the way that the negotiation in the world was doing until now, and have more a balanced world with North and South, not in a disparity and against each other, but work together for a better world for all of us. Thank you very much.
Thank you so much, Ethel. So we all have our homework now. We must come prepared. We must be ready with the evidence which has been put before us already, know where the gaps are, what are the operational difficulties, what the systemic change needs to be, as Professor Azar was saying. But we also need to focus on making sure that we bring the right people to the table. The citizens, the people in the communities, those who are actually suffering because of climate change and health, but those who are also in a position to do something about it. Now we have somebody else who is doing something about it. We have Vincent Breton, who is going to talk to us about climate smart health products. And he's working with Unit 8 and coming up with really brilliant collaboration with people on the ground who are working on this climate smart health products. Over to you, Vincent.
Thank you so much. Can you hear me? Thank you so much, Madam Chair. Good afternoon, everyone. And it's actually quite an easy job I have to talk after all of my co-panelists, because I think they've laid a great ground for what I'm going to say. And I'd like to take a moment also to congratulate and thank Brazil for the leadership on climate and health and putting it at the center of COP30. I'm actually going to start with this. You know, the Belém Health Action Plan has three components. One of them is innovation and production. And I want you to think about what may happen to a country, any country in the world, facing climate-related health challenges. First of all, there might be diseases that are climate-sensitive disease, and there might be a spike of an infection that is vector-borne, for instance. And there could be instances where there is no treatment for that disease, particular disease, or no vector control tool that works for the specific mosquito. Even if there is one such treatment, there might be situations where those need to be delivered to in emergency settings, to displaced population, in refugee camps, and where a complex administration is not possible. Even if that is solved, those products might be simply too expensive, as we see, unfortunately, far too often across global health. There may be issues around supply. What if this product is manufactured in one place in the world and that place just undergoes flooding? What if this is a product that actually cannot be stored at a high temperature? And in the country in question, temperatures are high and the product gets degraded. And finally, if it is a country that is focused, like many countries, on decarbonizing their health systems, obviously there is a need to have those supply chains low carbon. So all of those issues are not hypothetical issues. They are real issues right now, and obviously exacerbating issues in light of climate change. There's also one other common point across those issues, that they happen outside, mostly outside the boundaries of any single country. They all rely on regional or global systems, whether it's for innovation or supply chain. And I'm going to use a few examples from our work at Unites, or an organization based in Geneva focused on access to innovation and health products in low and middle income countries, to illustrate some aspects of that and some of the potential solutions. Starting with vector control tools. So we've heard earlier, mosquitoes are moving to different regions, diseases are progressing in different places, and also behavior of mosquitoes are changing. We need different vector control tools, and bed nets may not be suited for everything. There's a new generation of vector control tool that is particularly exciting, called spatial emanators, and you see one in the picture. It's a sheet of plastic with an ingredient, a chemical, that repels the mosquitoes and can be used, hanged in a home. And why is it such an interesting product from a climate standpoint? It's one that can be used in any setting, including in places like refugee camps where a bed net cannot be used. It's one that may have potential to be used across disease, like dengue and malaria as well. Second example, there's many treatments for infectious disease that require a long course of treatment. HIV treatment is a daily treatment for life. TB treatment takes 6 months. TB prevention is a 3-month course of treatment where you need to take a pill every week. Hepatitis C treatment, curative, works really well. 1 trimester, again, of treatment. Delivering those treatments in challenging settings, in places where populations are exposed to climate risk, where the health systems can be disrupted, where the medicines cannot be stored easily, is challenging. The good news is we have new technologies coming to the market. Long-acting formulation, replacing those pills and those many pills that need to be taken over a long period of time by a single injection. One such example is for HIV prevention. It's called lenacapavir. You may have heard about this product in other sessions. We just announced an agreement to have this product available at $40 per person per year, which makes it parity to the oral treatment, enabling countries to have this option for HIV prevention and increase the resilience of HIV prevention services. Third example, supply chains. There's many supply chains where obviously products are coming from India, from China, oftentimes from a few manufacturing sites in a few regions. If you look at HIV treatment, if you look at malaria treatment, you may find that 70–80% of the worldwide volumes come from 1 or 2 regions, very concentrated regions in India. India is a country that is prone to flooding already now. Obviously, in the next few years, that risk is going to increase. So supply chain disruption risks do exist. And we hear a lot about regional manufacturing. Actually, UNIT has been supporting regional manufacturing in a number of places. And I think what I'm trying to say here is that regional manufacturing is also a climate resilience solution. It's not just about sovereignty, it's about more diverse manufacturing footprints, shorter supply chain routes, and therefore stronger supply security in face of climate events. Another example, heat stability. What you see in the color boxes is different temperature ranges. And this is data coming from a study about 5 years ago, taking one specific product, medicine, that was traveling from Southeast Asia to Southern Africa. It's a journey that took, in this case, 92 days by sea transport, so being on a container, on a boat, traveling by sea, arriving in the customs, being cleared, then on a truck, and reaching the facility in the end. And you see here the distribution of time across temperature ranges for those medicines. A typical medicine that is meant to be stored at ambient temperature can be stored at up to 30 degrees. Any excursion above 30 degrees implies a reduction of the shelf life and the potential degradation of the product. In this particular example, what's striking is that the product has spent quite a number of hours above 30 degrees, up to 56 degrees. Right now, there is very little evidence telling us whether products and medicines that we use every day can actually resist those temperatures, and maybe that's okay, but maybe it's not. This was 5 years ago. Think about what this could look like in 5 years, 10 years, 15 years from now, where heat waves will increase in frequency, will increase in intensity, in particular in the countries or settings where we're trying to deliver quality health services. Example of solution, heat-stable products. For postpartum hemorrhage in maternal health, there is now a new product called heat-stable carbetocin that can be stored at ambient temperature and replace a cold chain product. Let me, with the final example, start with a quiz. So let's raise your hand. I have 3 sectors here, economic sectors, and I'm going to talk about the carbon footprint of those sectors. So who thinks aviation is the highest carbon footprint of those 3 sectors? Raise your hand. Couple. Health products? Few hands, not many. Data centers? Many hands. Okay, well, everyone's somewhat right. It's about the same. Except that data centers are actually half of this right now, but because of the exponential growth of artificial intelligence, it's actually growing very fast and could reach that 2.5% of global emission in just a few years from now. I'm using this to help us realize, and it's been mentioned, the 5% of emissions from the health sector, that oftentimes when we look at carbon footprints, we focus on a few sectors that are very visible, but health products are a key contributor. I'm not going to debate the social value of those respective sectors. I think we probably all agree in this room. But I want to emphasize the fact that there are solutions to decarbonize health products, and Victor just also mentioned some of those solutions. Green manufacturing solutions do exist to make the exact same product, potentially not at a higher price, but at a much lower carbon footprint. And also switching products. And there's new innovations that deliver better health services, but also are less carbon intensive than the previous generation of products. So in conclusion, as you see, health products and supply chain offer a range of challenges, but also opportunities in terms of climate mitigation and adaptation, which we have summarized in our own work under a simple framework called Climate Smart Health Products with those different dimensions. This is, even though this is a set of new issues that we're facing as a global health community, the solution space feels very familiar. And those of us working in global health are aware of the importance of innovation, the importance of market-based approaches, and then, of course, being demand-led and people-centered. And I want to conclude with one analogy. If we were talking about pandemic preparedness and response in this room, I think the first topic that would come to mind to all of us would be, where are the products, where are the vaccines, where are the medicines that will help us respond to the pandemic? And I want to encourage all of us to think about climate and health in a similar way. Where are the products, where are the supply chain that will help us respond and adapt and mitigate climate change? How do we look at them as global goods that we need to develop collectively across borders, and how do we make sure that there is equitable access to those solutions across the world? Thank you.
Thank you very much, Vincent. We would now like to open the floor, but as we open the floor, I just want the panel to think about a response to this question, which is I'm going to ask all of you. We have all been talking about what needs to be done, how it should be done, who needs to do it, when, where. But what are the potential trade-offs here that need to be considered? So can you think of that as we open the floor? Are there questions, comments? Young gentleman in front. Please introduce yourself and ask your question.
Hello, panelists and everyone. I'm Bob Shin, and I'm a year 1 medical student from Hong Kong. And first of all, thank you guys all for your very insightful presentations, and especially Dr. Zhao and Dr. Haynes for your work, not only in the Pathfinder Initiative, but also in the initiative you run at the National Academy of Medicine. As when I was studying global health, I was also looking at how when we design global policies, you inevitably kind of run into the conflict of deciding between incremental changes and also the drastic changes. Because on one hand, as Dr. Haynes has presented, we have a lot of like very drastic issues that we face at the moment. So we need those like drastic changes. And this is also echoed by Dr. Zhao. But at the same time, I'm just concerned that because health and climate are inherently like very kind of like very crucial, and the nature of the problems maybe that the causes are too great. So perhaps how you can like kind of balance that, and at the same time. Yeah, we also talked about how when we have these like global initiatives, it's also even though we have perhaps expertise from different regions, perhaps every WHO regions in itself is perhaps very diverse, and not only in healthcare system, but when you add this layer of like climate systems, it adds to the complexity a lot as well. So would you worry that perhaps there's a trade-off in terms of how it's a top-down approach versus perhaps how have you thought about the contextualization? Because I think these are obviously issues that you also encountered when you're drafting the different kind of like policies. And also, so my last is kind of like a call to action to like as like Dr. Isol Misel has talked about the COP. And so just now I ran into like some of my friends who are organizing this thing called a World Congress in Public Health. And it's actually also held in the Global South in South Africa next year, September. So if you guys are interested, you can take a flyer from the counter in the top. And I understand these are very tough questions. So apologies if, yeah. Thank you guys so much.
Thank you. Thank you so much. Can you pass it to the lady behind you? Thank you.
Hi, thank you very much. This is Elaine Fletcher from Health Policy Watch. I just wanted to ask Victor Zhao, how did you manage to get HHS involved in this grand challenge, which mentions the words climate and health equity in the same sentence?
Thank you
for asking that.
There is another lady in front here, then we go to the gentleman next to you.
Thanks. My name's Hanna Neumer. I'm Germany representative for WaterAid. So I come at this topic from the perspective of water sanitation and hygiene as a key health protection measure. But I'm not going to go into that. My question to you is countries like Germany and their international climate finance needs to have a fair share and needs to have a good distribution between mitigation and adaptation measures. Wash sector people typically call for 50-50. What would be your, as health experts, your recommendation for a partner like Germany in its international climate finance contribution? And
Thank you so much. There is a gentleman in the blue shirt, just there.
Yeah, thank you very much. Thank you, the panelists. That was a wonderful presentation and an eye-opener. My name is Victor AURC, a postdoctoral fellow from Institute of Genomics and Global Health, Nigeria, and I'm a medical sociologist. Now, the question is, I want to give a paradigm shift away from the biomedical now. Because if we are talking about climate change and health, the effect of climate change is seen in everything we are doing today. The AMR, the food we eat, are all results, I stand to be corrected, are all results of climate change because of its effect. But now the problem is we are looking at it from one perspective, the science. But have we ever asked ourselves, what are the roles of the social scientists, the medical sociologists, the anthropologists? Because if we can bring in these people into play, because they know the community, they know what the social determinants of it, what are their belief system. I think Professor Edin talked about culture. Culture is the way of life of the people because most of the things we do is as a result of our culture. So if the social scientists, who can bring the social scientists into play into this, so that we marry the two together, because we're talking about One Health. So the multidisciplinary aspect, if that can be done, or what do we want to do, if actually we want to solve this? Thank you.
Thank you.
Thank you.
There's the lady in, oh yeah, that gentleman next to the,
Thank you. Andrew Mackenzie from the Physiological Society. Thank you
Yeah.
for the presentations.
1, 2, 3, 4, 5.
Are there examples of particularly good forms of international cooperation that you could point to, as some of the big global initiatives take a lot of time and are maybe not moving in the right direction? Are there, for example, networks of cities or certain academic institutions that are able to drive meaningful change quickly?
Thank you. I think we'll go back to the panel. We'll go for a second round if we still have time. Members of the panel, we have 5 questions. You don't have to answer all 5, each of you. So if somebody has already answered one, you could maybe answer the next or add on to what someone else has said. So I'll start with Professor Hines.
Okay, well, thanks. I mean, great questions, and it won't be possible to answer them all in probably less than a few days. But just if I could have a go at 1 or 2 of them, the whole point about social sciences I totally agree with, and I work now in a very different way to the work I did perhaps 15 years ago. So all of the work we do now is transdisciplinary, and that involves a whole range of different scientists, ranging from climatologists at the sort of more quantitative end, through a whole range of different social scientists. Economists, I think, are gradually, we're working a lot more with economists now, because one of the challenges we have is that we externalize a lot of the costs of our activities. So when we burn fossil fuels, we don't pay the full economic costs. So we have to internalize those costs in order to drive us on a more sustainable trajectory. And as you say, the anthropologists, the psychologists, the social scientists of various types really have an insight into the social processes which really underlie many of the patterns of our economic development. So we can't really devise any kind of interventions without really working very closely with our colleagues in social sciences. So we are totally committed to that kind of transdisciplinary working. What I would say is that universities often don't value that. So universities often promote people on the basis of their own rather narrow disciplinary perspective. And I think that's a big mistake. Increasingly, we need to incentivize discipline hopping, changing from one discipline to another, learning from other disciplines. It's very important to learn the language of other disciplines. And so we should be incentivizing that much more in kind of university promotion strategies. Very quickly around incremental versus transformative, we need both, of course, because you do need to take people with you. You can't suddenly propose a dramatic transformation of the way in which they live unless you also address the kind of problems that they're facing day by day. So you have to somehow combine these incremental and these transformative changes, and transformative changes can never take place without the consent of the communities and societies which are going to transform. And I think if you try to impose policies on people, all you do is increase populism. And in fact, what I think's happened with some of the climate change policies is that people have seen them as being imposed on them and haven't been really convinced by the benefits to them individually and collectively. So we've done rather a bad job, I think, about selling the co-benefits of climate change policies. And indeed, that's one of the reasons why we're seeing some of them being weaponized against us now. We need to be much more sophisticated, I think, about how we communicate the benefits to the population more generally. I'll stop there. I could say more, but I'll hand it.
Thank you, Prof. Dr. Kimani?
Yeah, thank you so much. I think I'll first add to what Prof has talked about, transdisciplinary teams, which is very important. And for like social scientists, one of the emerging areas is lived experiences. And in climate change, we really need to be able to establish the lived experiences with the impacts of climate change on health. And we can't do this without the social scientists, so it's very important. I want also to go back to your question about trade-offs. So when we talk about some of the actions like maybe transition to clean energy in climate change, for developing countries, the trade-offs is that could be very expensive for communities, and we can't just expect that people will just transition. So really there is a lot of need for support for that kind of transition. Like for Africa, we can really, I mean, solar energy is something that we can really benefit from, but the transition to solar energy can be very expensive. So a lot of support is needed, but also understanding the core benefits. So that also, and empowering like communities or for account to hold the duty bearers accountable and really to support these transitions. Yeah, thanks.
Thank you, Dr. Kimani. Professor Zhao?
Yeah, I mean, there's so much to talk about. And first of all, I really enjoyed the panel, all the way to, in fact, the idea of new mechanisms or technology to address some of the issues. And of course, COP30 is so important. I would say the following. Absolutely, nobody disagrees with whatsoever. In fact, everyone agrees with the need for social science. I would go beyond that. I would say the need for convergent science. You call multidiscipline, but I think these terms is bringing all aspects of science together to solve a problem. I wrote a Lancet, for example, population health is a convergent science issue because you got your behavioral, social, and others. Believe it or not, in our academy, our bylaw says 1/4 of our members should not be in the medical sciences. So we have social scientists, economists, and others, because we realize the issue that we deal with every day in health and beyond involves many other different sectors. I think the trade-offs are substantial, but as Elizabeth said, you have to be ready for some trade-offs. I mean, I think, was it on your slide, aviation? What are the other two again? Oh, data center, right? I mean, imagine, this is your life, right? How do we all get here? 4,000 people came to this meeting, presumed by plane, some maybe by other means. So food, right, and trading lifestyle. So these are trade-offs, but the co-benefits are so amazing that we certainly have to consider them. On a more specific issue, the HHS involvement was the past administration, I did say that, not current one. But we did have a lot of together, government, public, private working together. And even though right now we may not have as much engagement with the government, we are keep moving in many of the things that we've learned and to, in fact, bring it out to as many people who want to learn. We have journey maps, decarbonization, many other things. I don't want to say one last thing, which I failed to say. When you think about academies, what do they really do? Well, as I said, if you look at the BELIM action plan, there are 3 major actions. There's surveillance and data, there's innovation and capacity building, and then there's local production. All these are driven by science, as you talked about, right? And you need scientists, you academics. So we need to be involved with this. And so what we've done, I think I told you, we've now launched a global coalition of academies of medicine on climate and health. And we're now supporting a statement endorsing the BELIM action plan, which focuses on health and climate.
Thank you so much, Prof. Ethel, is there something that you like to respond to?
I think I would like only to add in this interdisciplinary conversation the importance of communication, because it's clear for me that we are failing a lot because we are the convinced one. All of us here, we believe this. We know we are here because we are committed with this. How to convince the ones that are not here? So even in the community, and in the tropical country, it's even more difficult because people live their life in summer, in heat waves, and how to convince that this is not good for your health. So communication, I think for me, it's a key element. And when Professor Hein is telling about the populism that was growing and things that we are seeing in the world. People are able to convince others, and a lot of others, that immigrants are the problem for their lives. And we not convince people that climate change is the problem for their lives. So we are failing in this part of the communication skill, and I think we need to change word, because climate change is so abstract. Net zero, it's like no one's know about this. So we are choosing some words that it's difficult to the population. So we need to create like a plan for a better communication to convince the outsider that are not in this room that is matter for their daily lives.
Thank you so much. Vincent?
Thanks. A couple of reflections. One around the trade-offs. I think it's a very important point. But I want to emphasize that sometimes trade-offs are perceived trade-off as opposed to real trade-off. And you started your presentation, Andy, with win-wins examples and places where you can achieve health benefits, climate benefits from the same interventions. And I think there's many examples of that before we get into like the really tough trade-offs that may occur at some point. Take heat-stable products, for instance. A heat-stable version of a product may be slightly more expensive. But being heat stable means you may not need to use a cold chain. So you're saving on your energy consumption all along the way from that. You're saving on your carbon emissions as well, because cold chain produces carbon emissions. You're saving on the waste, because when products are deteriorated, and we have many examples of that, you start using multiple products to get the same effect. So you like do two treatment courses because the product is not working as well. And finally, if you have a product that's degraded, you lose the trust of the healthcare workers, of the communities in the products. So those are all like co-benefits of a heat-stable product, and maybe, yes, at some point the product could be more expensive, but that's counterbalanced by all those benefits. There was a question on international cooperation. I should mention one very important platform called ATTACH, the Alliance for Transformative Action in Climate and Health. I think all of us are probably part of it. It's a platform led by the WHO, which brings together countries, Ministries of Health from, I think, close to 100 countries at this point, from around the world, north, south, and also partner organizations. It's a very open collaboration platform working on joint deliverables, sharing best practices, experience, and lessons. And if you're not aware, I think it's a good one to look at.
Thank you, Vincent. I think we have time for just 2 more questions. And this lovely lady had her hand up earlier, and another lovely lady at the back.
Yes, thank you very much. I'll try to keep it short. My name is Dorothea Baltrux. I'm the director of the Center for Planetary Health Policy. We're a think tank based here in Berlin. And my question is about the commercial determinants of health, which of course the Lancet has been working on, and which we find is a concept that resonates a lot with the challenges we're facing, because we all know what to do, but we also know there are some vast interests in, let's say, keeping the status quo, keeping those subsidies and fossil fuels. In the food area, we have that problem a lot. So I'm just wondering what your advice would be on policy recommendations to tackle that. And also what you think about the shift that we're witnessing to, even in the NGO world and the research world, that we have to think a lot more in the return on investment terms. And if we're not falling into the same kind of idea that everything has to be a return on investment, and what do we do about the areas on climate change and climate adaptation that are not returning investment quickly enough? Thank you.
Very good questions. And the lovely lady at the back.
Thank you very much. My name is Sophie Gepp. And my question would be regarding the groundbreaking advisory opinion of the International Court of Justice on climate justice and on the responsibilities of states, but also underlining the very strong call for keeping to the 1.5 degree on the basis of human rights and the right to health, among others. And I wondered, what role does this advisory opinion play in the policy spaces that you are in, and do you see this as something that can push the much needed action in a very difficult current geopolitical environment? Thank you very much.
Excellent question. Again, I'll give you, we only have 5 minutes, so I would say in responding, also give your concluding remarks, just 1 minute
And
each.
there's no one to answer.
Maybe you can answer the question.
Okay. Well, look, very, very important questions. International Court of Justice, absolutely, I think there's a big role for health professionals working with colleagues in the legal profession to actually have an impact on climate litigation. One of the things that will be a game changer is the whole area of attribution science, because the reason that some of these cases have failed is because they haven't made the actual link with human-induced climate change and the health impacts. And we're seeing a revolution now in attribution science, such that it's now possible to confidently attribute a certain proportion, say, of deaths from the heat, for example, to human-induced climate change. And so we can go and use that evidence in supporting court cases. So I'm pretty confident that we'll see a much greater success rate in the future with these new developments in attribution science. The second issue around commercial determinants, again, really important. You may have seen Anna Gilmore's recent paper showing that the commercial determinants of health are really responsible for a very substantial proportion of premature deaths across the whole planet. Fossil fuels, food, energy, I can't remember the other sectors, but the whole range of different sectors that she quantified. Tobacco, obviously, and alcohol were the 4 big ones. So if you put those all together, you come up with many millions of premature deaths. And the problem is that our regulatory systems are not effective in dealing with the commercial interests. We need to change the incentive structure. That sometimes means regulation, sometimes means taxes. There will always be opposition to that. So we need to get much better at facing down the opposition of these powerful interests. We can learn something from the work around tobacco, which has been at least partially successful. And I think we need to be much more robust in confronting these commercial interests because they are driving many of the challenges to humanity that we're seeing at the moment. And we need to also build common cause with those parts of the private sector that have got a different business model, that actually see their business future as being supporting planetary health. Well, we can work with those people constructively. And there are those in the middle that haven't quite made up their minds. And so we need to convince those middle people that actually they need to go on the planetary health agenda, not on the destruction of planetary health.
Thank you. We have just over 2 minutes left. So I'm going to ask our panelists to give one concluding message, 1 or 2 sentences, not more each. What would you like everybody who came to this session, who is so passionate about creating what the minister called a livable future for this planet, what message do you want them to go away with? I'll start with you, Vincent.
Thank you. Well, I'll borrow from Victor. I think this is a sectoral transformation. We're not talking about global health, business as usual, or global health with a little bit of climate in it. We're talking about a fundamental relook at the way we work, the products we use, and how we function.
Thank you, Vincent. Ethel?
I put climate justice as the center of the conversation. And I think most because of this international court, this word came with a lot of cautious from the country. But I push for this word to be in our agreement as a very important, although we are interconnected, we are very different.
Thank you, Ethel. Professor Zhao?
Collective action and culture. Until we really all work together for the same reason and we create a culture of climate resilience and responsibility, it's going to be an uphill battle.
Thank you, Professor. Dr. Kimani?
Yeah, I would like to emphasize the issue of equity and climate justice and following the human rights-based approach, because really there are obligations nationally and internationally for human rights, and a lot of rights are violated through the issues of emissions and the climate change. So I think if we follow human rights-based approach, we can be able also to do public interest litigation like Professor Heinz was talking about. Thanks.
Thank you. Professor Heinz.
Well, I'll mention just 2 words, really. One is stamina. It's really important to keep going, despite any discouragement, and don't be discouraged too much, because one of the reasons we're getting pushback is because science has been quite successful in showing that we're having a crisis and also pointing the finger at who's responsible. So it's no surprise we have a big pushback. The second is, I think, hope, and I would distinguish between hope and optimism. I think we should still all remain hopeful, because we know that many of the things that have to be done, we know how to do them. We may not know exactly how to implement them, but we know what needs to be done. So it's very important to keep hope in these difficult times and to forge ahead, work together to achieve the aim that we all want to achieve, which is, I think, health and equity within planetary boundaries. Thank you.
Thank you. Let's give our panelists a hand. So there you have it. Yes, health is at risk, but there is a lot that we can do to let us continue to push the agenda. We have got tools, including legal tools that we've been given by the ICJ. We've got scientific tools, and we have tools that we still need to explore from other sectors, including from behavioral scientists and from the One Health and environment people, but even from the finance sector. So the tools are available. Let us go and use them, because this livable planet is our responsibility. It is at risk, and we can save it. Thank you so much for joining us this afternoon.